This is Corey Miller. He's the Vice President of the Saskatchewan Cancer Agency and the person who responded to Ric's letter of concern when he was denied follow-up treatment. What was your reaction when you read Ric's letter?
Well, certainly when I read Ric's letter, we didn't read it as a letter of complaint. We read Ric's letter as a letter of opportunity, and we're thankful to Ric and his family for pointing out the glaring opportunity that's in front of us for the Saskatchewan Cancer Agency to better know and understand traditional medicine and traditional knowledge.
Has his situation impacted what you'll do going forward?
For sure, not just going forward for every individual patient, but coming up with programs and strategies on how we can respectfully rebuild the trust between our healthcare system and our Aboriginal community.
How do you plan to do that going forward? Is it a matter of conversation with doctors and patients and education, that kind of thing?
Well, I don't think there is a magic bullet. I think the first step is listening and understanding from our Aboriginal communities what their goals and expectations are, and for us to listen to them as to what are their traditional medicines and knowledge. And for good reason, our Aboriginal community doesn't have trust in our system, and that's because of the history that we have in the way that we've mistreated them in our centers, but also in the way that we've taken some of their traditional medicine without input from them. So we've had lots of conversations with Ric and his family, and now it's engaging the broader community in having input in helping us design a system that works better for them.
How do you think doctors will respond? They've gone to school and been educated with taking a certain course of action towards treatment, in particular when it comes to cancer. So how do you explain to them how to approach this in a way that might be quite different than what they learned in medical school?
Well, I think it's working with them to develop this new strategy and new strategies. It isn't one strategy. It's working with our physician community and our Aboriginal community to design a system that everybody knows, trusts, and respects.
Is there ever reasonable grounds for a doctor to deny treatment to a patient?
Well, I wouldn't say it's denying treatment. I think what has happened is sometimes it's communication, right? So we should be following up all of our patients on progress and treatment, how they're doing, whether they're taking our treatment or others, but it isn't always going to be done by the specialist. So it's communicating to the patient and their primary care team that's out in the community on how they can be following up on their disease prognosis so that we can help patients and their families make decisions on their next course of action, whether it's our treatments or theirs.
So it is important then for doctors to understand that they don't have the final word on what a course of treatment is?
I mean, ultimately, in the Saskatchewan healthcare management system, we have a patient-centered approach to healthcare, and ultimately our patients make choices about their own. What we need to do is support them and enable them to make healthy choices to the best of our ability. And when I say our ability, I include the patient, family, and the care team.
Thanks for your time today, Corey.
Our pleasure. Thank you.